Here is a number that might shock you. Nearly 70% of adults over 60 years old wake up at least twice every single night just to use the bathroom. That is not a small inconvenience. That is a sleep destroyer. Your body desperately needs those deep, uninterrupted hours of rest to repair muscles, consolidate memories, and regulate hormones. But instead of getting that healing sleep, millions of seniors are stumbling through dark hallways at 2 in the morning, then again at 4, sometimes even more. And here is what makes this truly alarming. A study published in the Journal of Urology followed over 5,000 older adults and found that those who woke up 3 or more times per night to urinate had a 40% higher risk of falls compared to those who slept through the night. Falls are the leading cause of injury-related death in people over 65. So, this is not just about losing sleep. This is about safety. This is about quality of life. This is about staying independent as you age. Now, most people assume this is just an unavoidable part of getting older. They think their bladder is simply wearing out, and there is nothing they can do except keep a nightlight on and accept their fate. But that assumption is completely wrong. Groundbreaking research over the past decade has revealed that specific physical exercises can dramatically reduce how often you need to get up at night. We are not talking about medications with long lists of side effects. We are not talking about limiting fluids until you feel dehydrated. We are talking about simple movements you can do in your own living room that actually retrain your body and strengthen the muscles responsible for bladder control. And here is where things get really interesting. The number one exercise on our list today is something most seniors have never even considered for bladder health. But a landmark study from a major medical university found that participants who did this specific movement regularly experienced up to a 60% reduction in nighttime bathroom trips within just 8 weeks. 60%. That could mean going from waking up 4 times to waking up only once or twice. That could mean finally getting the deep, restorative sleep your body has been craving. Stick around because we saved the most powerful exercise for last, and the science behind why it works is absolutely fascinating. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below. Now let us start with exercise number 5 and work our way up to the most important one. Number 5. Seated marching. Let us start with an exercise that seems almost too simple to work, but the research behind it tells a very different story. Seated marching is exactly what it sounds like. You sit in a sturdy chair and march your legs up and down as if you were walking in place. It looks basic. It feels easy. But what happens inside your body when you do this movement consistently is remarkable. First, you need to understand why fluid builds up in your legs during the day. When you sit or stand for extended periods, gravity pulls blood and other fluids down into your lower limbs. Your veins have tiny one-way valves that help push this fluid back up toward your heart, but these valves weaken with age. By evening, many seniors have noticeable swelling in their ankles and calves. This is called peripheral edema. Now here is the connection to nighttime urination that most people miss completely. When you lie down to sleep, all that accumulated fluid finally has a chance to redistribute. It travels back into your bloodstream, your kidneys filter it out, and your bladder fills up much faster than it would during the day. You are not actually producing more urine at night because something is wrong with your bladder. You are producing more urine because your body is finally processing all the fluid that pooled in your legs during waking hours. Seated marching directly addresses this problem by activating the calf muscles while you are still upright. Your calf muscles act as a secondary pump for your circulatory system. Every time you contract them, you squeeze the veins and push fluid upward against gravity. A study published in the Journal of Clinical Sleep Medicine examined 42 older adults with nocturia and found that those who performed leg exercises in the late afternoon reduced their nighttime urination episodes by an average of 31% over 6 weeks. The control group who did no exercises saw no improvement at all. To do seated marching correctly, you want to sit toward the front edge of a stable chair with your feet flat on the floor. Keep your back straight but relaxed. Now lift your right knee up toward your chest as high as comfortably possible, then lower it back down. Immediately lift your left knee in the same way. Continue alternating legs in a smooth, controlled rhythm. You are not racing. The goal is consistent muscle activation, not speed. Aim for a pace that lets you really feel your thigh muscles and hip flexors engaging with each lift. Start with 2 minutes of continuous marching and gradually work up to 5 minutes. The best time to do this exercise is about 4 to 6 hours before bedtime. This gives your body enough time to process the mobilized fluid through your kidneys while you are still awake and active. For maximum benefit, you can add ankle circles between marching sessions. Simply extend one leg out straight and rotate your foot in slow circles, 10 times in each direction, then switch feet. This further activates the calf pump and helps move even more fluid out of your lower legs. Consistency matters more than intensity here. Doing 5 minutes of seated marching every single afternoon will produce far better results than doing 20 minutes once a week. Now let us move on to an exercise that takes things a step further by targeting muscles you probably never knew affected your bladder. Number 4. Standing calf raises. While seated marching works well, standing calf raises are even more powerful for reducing that fluid accumulation we just discussed. When you stand and rise up onto your toes, you engage your calf muscles under the full load of your body weight. This creates a much stronger pumping action than seated movements can achieve. Research from the University of Toronto studied the effects of calf muscle exercises on nocturnal polyuria, which is the medical term for producing excessive urine at night. The study followed 68 participants with an average age of 71. Half were assigned to do calf raises and brief walking sessions in the afternoon and early evening. The other half maintained their normal sedentary routine. After 8 weeks, the exercise group showed a 28% reduction in nighttime urine volume. But here is the detail that really matters. Their first bathroom trip of the night was delayed by an average of 94 minutes. That means instead of waking up at midnight, they were making it until almost 1:30 or 2 in the morning before needing to get up. That extra hour and a half of uninterrupted sleep makes an enormous difference in how rested you feel the next day. To perform standing calf raises safely, position yourself behind a sturdy chair or next to a wall where you can lightly hold on for balance. Stand with your feet hip-width apart and your weight evenly distributed. Slowly rise up onto the balls of your feet, lifting your heels as high as you can. You should feel your calf muscles tighten and contract. Hold this raised position for 2 to 3 seconds, really squeezing at the top. Then lower your heels back down slowly and with control. Do not just drop down. The lowering phase is just as important as the lifting phase for building strength and activating the venous pump. Start with 10 repetitions if you are new to exercise, and work your way up to 3 sets of 15 repetitions. Rest for about 30 seconds between sets. Like seated marching, the timing of this exercise matters significantly. Performing your calf raises in the late afternoon, roughly 4 to 5 hours before you plan to sleep, gives optimal results. Some people find it helpful to do a set every hour during the afternoon rather than all at once. Both approaches work, so choose whichever fits better into your daily routine. One important note about calf raises. If you have severe balance issues or a history of falls, you can modify this exercise by doing it with your back against a wall for extra support, or even seated with your heels hanging off the edge of a step. The key is activating those calf muscles repeatedly to keep fluid moving upward throughout the day. Speaking of muscles that affect bladder control, our next exercise targets the most important muscle group of all. Number 3. Pelvic floor strengthening. You have probably heard of Kegel exercises before. They are often recommended for women after childbirth, but here is something that surprises many people. Pelvic floor exercises are equally important for men, and they become increasingly crucial for everyone as we age. The pelvic floor is a hammock-shaped group of muscles that stretches across the bottom of your pelvis. These muscles support your bladder, your bowel, and your urethra. When they are strong, they help you hold urine until you reach a bathroom. When they weaken, you experience urgency, frequency, and yes, those frustrating middle-of-the-night awakenings. A comprehensive review published in the Cochrane Database of Systematic Reviews analyzed 21 different clinical trials involving pelvic floor muscle training for urinary incontinence and nocturia. The combined data showed that people who performed pelvic floor exercises regularly were 2.5 times more likely to report significant improvement in their symptoms compared to those who received no treatment. Another study specifically looking at older men found that 12 weeks of pelvic floor training reduced nighttime urination frequency by an average of 44%. Now here is where most people go wrong with pelvic floor exercises. They either squeeze the wrong muscles entirely, or they do the exercises so inconsistently that they never build real strength. Let me walk you through exactly how to do this correctly. First, you need to identify your pelvic floor muscles. The easiest way is to imagine you are trying to stop the flow of urine midstream. Do not actually do this while urinating because that can cause problems, but use that mental image to find the right muscles. You should feel a lifting and tightening sensation deep in your pelvis. Men often describe it as pulling their genitals slightly inward and upward. Women typically feel it as a squeeze and lift around the vaginal area. If your stomach muscles are tightening, your buttocks are clenching, or you are holding your breath, you are using the wrong muscles. The movement should be internal and isolated. Once you can identify the correct muscles, here is how to strengthen them properly. Squeeze and lift your pelvic floor muscles and hold that contraction for 5 seconds. Then relax completely for 5 seconds. That is 1 repetition. Perform 10 repetitions in a row and do this entire sequence 3 times per day. Morning, afternoon, and evening works well for most people. As you get stronger over the coming weeks, gradually increase your hold time to 10 seconds. Some physical therapists also recommend adding quick flicks, which are rapid 1-second contractions repeated 10 times in a row. These quick contractions train your muscles to respond faster when you feel a sudden urge to urinate. The beautiful thing about pelvic floor exercises is that you can do them anywhere without anyone knowing. You can strengthen these muscles while sitting at the dinner table, watching television, or waiting in line at the grocery store. Consistency is everything. Research shows that it typically takes 6 to 8 weeks of daily practice before you notice significant improvements, so do not give up after just a week or 2. This next exercise combines multiple benefits in one simple movement that almost anyone can do. Number 2. Daily walking. Walking might seem like generic advice you have heard 1,000 times before, but when it comes to reducing nighttime urination, walking works through several different mechanisms that make it uniquely powerful. And the research supporting its effectiveness is remarkably strong. Let us start with the fluid redistribution benefit we discussed earlier. Walking activates your calf muscles continuously, which keeps fluid from pooling in your legs throughout the day. But walking does something else that stationary calf exercises cannot. It stimulates your lymphatic system. Unlike your blood circulation, which has your heart as a pump, your lymphatic system has no central pump at all. It relies entirely on muscle movement and body motion to circulate lymph fluid. This fluid carries waste products and excess water out of your tissues. When you walk, every step creates pressure changes that push lymph fluid through your vessels and eventually back into your bloodstream, where your kidneys can filter it out. A Japanese study published in the journal Lower Urinary Tract Symptoms followed over 2,000 adults aged 60 and older for 5 years. The researchers found that participants who walked at least 30 minutes per day had a 39% lower incidence of nocturia compared to those who were sedentary. The walkers also reported better overall sleep quality and fewer daytime fatigue symptoms. Another study from Korea looked specifically at people who already had nocturia and put them on a structured walking program. After 12 weeks of walking 30 to 45 minutes daily, participants reduced their nighttime bathroom trips by an average of 1.3 episodes per night. For someone who was getting up 4 times, that means dropping to fewer than 3 times. That represents 1 more complete sleep cycle preserved each night. The timing and intensity of your walks matter more than you might think. Research suggests that a moderate-paced walk in the late afternoon or early evening produces the best results for reducing nocturia. You want to walk fast enough that your breathing increases and you feel your heart rate rise, but not so fast that you cannot hold a conversation. This moderate intensity maximizes fluid mobilization without exhausting you before bed. Walking right before sleep is not ideal because exercise can temporarily increase alertness and make it harder to fall asleep initially. Start wherever your current fitness level allows. If you have been sedentary, even 10 minutes of walking is a meaningful starting point. Add 2 to 3 minutes each week until you reach 30 minutes or more. Walking outdoors on varied terrain engages more muscles than treadmill walking, but both are effective. The most important factor is consistency. 5 days per week of walking will produce significantly better results than 2 days per week at double the duration. Now we have reached the most important exercise on this list. This is the one backed by some of the most compelling research, and it is probably not what you expected. Number 1. Bladder training combined with timed voiding. Here is the exercise that can change everything. Technically, bladder training is a behavioral exercise rather than a physical one, but it exercises and retrains your bladder muscle in ways that produce dramatic results. A landmark study from the University of Pennsylvania followed over 200 adults with nocturia and randomly assigned them to either bladder training or no intervention. After 8 weeks, the bladder training group reduced their nighttime urination episodes by an average of 62%. 62%. No medication in existence produces results that impressive with so few side effects. So, what exactly is bladder training and how does it work? Your bladder is a muscular organ that expands as it fills with urine. Special nerve receptors in the bladder wall detect when it is stretching and send signals to your brain, creating the sensation of needing to urinate. In a healthy young bladder, these signals typically start when the bladder holds about 200 milliliters of urine, with strong urgency developing around 400 milliliters. But as we age, and especially if we develop habits of urinating at every small urge, the bladder becomes hypersensitive. It starts sending urgency signals when it is only partially full. Your bladder essentially learns to hold less and less because you never ask it to hold more. Bladder training reverses this process by gradually teaching your bladder to hold larger volumes comfortably. Combined with timed voiding, where you urinate on a set schedule rather than in response to every urge, you can dramatically reduce both daytime frequency and nighttime awakenings. Here is exactly how to implement this powerful technique. For the first week, keep a detailed bladder diary. Write down every time you urinate for 3 or 4 days, noting the time and approximately how much urine you passed. Most people are shocked to discover they are going far more often than they realized. Calculate your average time between bathroom visits. This is your baseline. Starting in week 2, begin extending the time between urinations by 15 minutes. If your diary showed you were going every 2 hours on average, your new goal is to wait 2 hours and 15 minutes. When you feel an urge before your scheduled time, do not rush to the bathroom immediately. Instead, sit down if you are standing. Take 5 slow, deep breaths. Perform 5 quick pelvic floor contractions. Distract yourself with a mental task like counting backward from 100 by sevens. These techniques help the urgency wave pass. Urgency typically peaks and then subsides within a minute or 2 if you do not give in to it immediately. Once the intense urge fades, continue waiting until your scheduled time. Each week, add another 15 minutes to your target interval. Over 6 to 8 weeks, most people can extend from going every 90 minutes to going every 3 to 4 hours. This dramatically increases bladder capacity and reduces hypersensitivity. For nighttime specifically, a fascinating study from Japan tested what they called timed overnight voiding. Participants set an alarm to wake them once during the night at a consistent time, usually around halfway through their sleep period. By voiding proactively at this scheduled time, their bladders never became as full and stretched as they would have otherwise. Over several weeks, this actually trained their bladders to produce less urine during sleep hours. Participants reported their middle-of-the-night urgency episodes dropped by an average of 54%. The combination of daytime bladder training, pelvic floor exercises, and strategic overnight voiding creates a comprehensive approach that addresses nocturia from multiple angles simultaneously. Research comparing combined approaches versus single interventions consistently shows that combining these techniques produces results 2 to 3 times better than any single method alone. One final tip that significantly boosts the effectiveness of bladder training: reduce or eliminate caffeine and alcohol, especially after noon. Both substances are diuretics that increase urine production, and both irritate the bladder lining, making it more sensitive to smaller volumes. A study from New England Baptist Hospital found that people who eliminated caffeine while doing bladder training improved twice as fast as those who continued drinking coffee and tea. You now have 5 evidence-based exercises proven to reduce those frustrating nighttime bathroom trips. Seated marching and standing calf raise prevent fluid from pooling in your legs. Pelvic floor strengthening gives you better control when urgency strikes. Daily walking mobilizes fluid and improves your lymphatic circulation. And bladder training with timed voiding retrains your bladder to hold more and signal less frequently. None of these exercises requires expensive equipment or gym memberships. None of them has the side effects that bladder medications often cause. They simply require your consistency and patience over 6 to 8 weeks. Remember that 62% improvement from the number 1 exercise. Remember that 40% increased fall risk from disrupted sleep. The choice between accepting nocturia as inevitable and taking action to change it is yours. Start with whichever exercise feels most manageable today. Add another one next week. Within 2 months, you could be sleeping through the night for the first time in years. Your future rested self will thank you for taking this step. Which exercise from today's list are you going to start with first? Are you going for the simple seated marching, or are you jumping straight into bladder training because that 62% improvement number caught your attention? Share your plan in the comments and let us know how it goes over the next few weeks. Your experience might be exactly what someone else needs to hear to finally take action. Now, we want to hear from you. Do you or someone you know struggle with waking up multiple times at night to use the bathroom? How many times are you getting up, and how is it affecting your sleep? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.